The 12th season of American Horror Story, starring Kim Kardashian and Emma Roberts, is all about fertility. Thank you to everyone who reached out, asked if I've watched the show. Yes. And everyone who asked if, from my perspective as a fertility doctor, whether the storylines and plot twists are close to reality or not. I have loved this season so far, and I cannot wait to share with you what I think the show gets really right about fertility and what they get absolutely wrong. In this video, we're going to go through episode 1. It's titled Multiply Thy Pain, and it's all about the main character, Anna, and her egg retrieval and embryo transfer. We're going to go through what the show gets right and wrong about these delicate IVF procedures. I'm Dr. Lora Shahine. I'm a double board certified OBGYN and reproductive endocrinologist helping people build families for almost 20 years. I've been doing IVF for almost 20 years. I love educating. You can find a lot of content on my website, drlorashahine.com. You can find links to the books I've written on fertility and miscarriage. You can sign up for my newsletter so you get weekly updates on what's going on in fertility these days. You can find links to my Instagram, TikTok, Threads account. I love reaching people and helping answering questions. And that is exactly what we're doing here today. Make sure you subscribe to this YouTube channel so you get my weekly video all about fertility and reproductive health. Now let's get to the first episode of American Horror Story season 12 and what we're going to cover in this episode, which is all about episode 1. There are 4 things we're really going to talk about. Number 1, we'll go through a little bit of the show and the plot line for episode 1. Number 2, we're going to go through Anna's egg retrieval and just how important it is to be on time for this procedure because Anna almost missed it. Number 3, we're going to go through an embryo transfer, fresh transfer versus frozen transfer, and whether you really can just pick the day of the transfer that works with your work schedule, because that's what Anna thinks. And number 4, we're going to go through what the show shares about how someone who's going through infertility can feel about themselves and how they really get this right. First topic, let's talk about the show. American Horror Story is a wildly popular American anthology TV series created by Ryan Murphy and Brad Falchuk for the cable network FX. It first aired in 2011, and this season is actually season number 12. Each season plays like a mini-series and has its own plot lines and its own stars. Past stars have included Jessica Lange, Kathy Bates, Lady Gaga, and more. The 12th season, which is what we're talking about, of American Horror Story, is titled Delicate, and it's based on a book called Delicate Condition by the author Danielle Valentine. This season stars Emma Roberts as the movie star Anna Victoria Alcott, who has a wildly popular movie that's out. She is seeing her stardom really come forward, and she's actually up for an Academy Award this season. A lot of the tension through the show is trying for Anna to balance this incredible part of her career that's really blossoming and her desire to become a mom and going through fertility treatments. Matt Zuckery also stars as Anna's husband. You might know him from Gilmore Girls or The Good Wife. You also might know the character actor Dennis O'Hare, who acts as the creepy but supportive fertility doctor, Dr. Andrew Hill. And I love seeing Kim Kardashian play Siobhan Corbin, this ruthless, tenacious PR representative for Anna, who will do anything to get Anna that Oscar. So the plot for episode 1, and there might be some spoilers, so maybe go watch the show before you finish this video, but it's basically Anna going through her egg retrieval and an embryo transfer all the time, trying to balance interviews and things that she needs to do for her career. So there's a lot of tension there between trying to do fertility treatment, to become a mom, and also trying to really honor what she's worked so hard for in her career and just so close to getting what she wants. So topic number 2, the egg retrieval. So a big part of the plot is Anna trying to get to her egg retrieval on time. It opens with her husband calling and saying, "Hey, I flew in from Berlin and I'm here. And where are you? We have an appointment. You need to do your egg retrieval." And Anna is confused and she's like, "No, I was planning ahead. Everything's okay. Okay, I'm going to rush right there." So she does actually make it to the retrieval and they do get eggs, but whoa, talk about creating tension for a fertility doctor. This is something that I truly stress out about for my patients, because if you are late for your egg retrieval, the whole cycle can be a bust. And it is because there is delicate timing. When we give that very last shot, we call it the trigger shot, we're trying to time the egg retrieval approximately 36 hours later. There is some variation with patients and clinic protocols, but about 36 hours later, because we're trying to make sure that the eggs are mature and they're ready to ovulate, but we don't want them to actually ovulate before we can go in and get them. And so if you really are late for your egg retrieval, the whole cycle can just be a bust and you have to start all over again. So topic number 3, Anna's embryo transfer. So she gets the good news after the retrieval that the eggs fertilize and they're watching the embryos grow. And her doctor says, you should come in on this day for your embryo transfer. And Anna is so conflicted because her incredible PR representative, Kim Kardashian, I'm sorry, I just can't think of her as the character Siobhan. It's Kim Kardashian, has booked her with an incredible opportunity for her career. It's her first late night appearance with Andy Cohen, and it would be on the same day as her embryo transfer. And so Anna says and bargains with her IVF doctor, can we please do it the next day? I just really have this important thing for my career. And her doctor says, well, it's not ideal, but okay. No, this just does not happen in real life. There are appropriate days for the embryo transfer, and you can't just do it on a day that is right for you and right for your career. I totally get it for the show. I think a lot of the theme of the show is the push and pull between wanting to be a mom and a parent, and then also wanting a career, and how trying to fit these two things together is really hard. As a physician and a former IVF patient and fertility patient myself, truly understand this conflict, and the show depicts it very well. One thing that I think is interesting is that the show depicts a fresh embryo transfer, and that's actually not very common in my practice. Of course, there are times where we do a fresh embryo transfer, but there's so many benefits for doing a frozen embryo transfer. That has actually become much more common over my career. So knowing that you're pregnant sooner is a huge positive for fresh embryo transfers, and I absolutely understand that. But I can think of 4 negatives for a fresh embryo transfer compared to frozen, and I want to share it with you. Number 1, you're at higher risk of ovarian hyperstimulation syndrome with a fresh embryo transfer. This is not true for everyone, and I have 2 long form videos here on YouTube all about ovarian hyperstimulation syndrome, which is a serious risk factor for IVF. Number 2, a fresh embryo transfer has a slightly higher risk of ectopic pregnancy compared to frozen. Number 3, you can't do genetic screening of embryos and also have a fresh embryo transfer. Genetic screening of embryos requires biopsying cells away from the embryo and then freezing that embryo in order to wait for the information to come back. And number 4, there are times where people have a lower success rate with a fresh embryo transfer. If you overstimulate in the cycle, if you have really high estrogen levels, if you start making progesterone too soon, that can throw off the communication between the embryo and the uterine lining so that you have a lower chance of implantation. There are wonderful reasons to do a fresh embryo transfer. There are very appropriate circumstances where you do a frozen embryo transfer. Make sure you talk to your doctor about what's right for you. All right, and topic number 4, Anna's feelings about her fertility struggles. This is something that the show gets really right, and I actually want to watch a scene with you. To set the scene, Anna and her husband have made it to the egg retrieval. They've talked to the anesthesiologist, and they have this moment, just the 2 of them, right before she goes back to her egg retrieval, and I would love to watch this with you.
It's gonna happen this time. I can feel it.
Do you still love me?
Even though you were late to the appointment I flew in on a red eye from Berlin to make? Yeah.
I mean, even though I'm broken.
Maybe you are not broken. We have unexplained infertility like 30% of other couples. It's nobody's fault. All this will be worth it once we meet our perfect baby.
And then they kiss. So I feel that scene so much. They get it, and they get it so well. As a former fertility patient and someone who did IVF as well, this scene really resonates with me. A lot of my patients talk to me about feeling broken. I felt broken, felt like less of a person because I couldn't get pregnant. Isn't that what we're supposed to just be able to do as humans? Worrying about your partner, feeling that you're less than because you can't, do this for them as a couple. I just really appreciate how Emma is feeling, Anna is showing so much vulnerability, and that her husband is showing so much support. It's beautiful. And just nailing that feeling of being broken is incredible. In fact, my book on miscarriage and recurrent pregnancy loss, I entitled it Not Broken. And the cover of the book is actually representing Japanese art form called kintsugi, where a broken piece of pottery is put back together with beautiful gold and lacquer. And it's trying to represent that you are what happens to you in the past. You are what makes you feel broken. But when you come back together and you move forward, you're actually more beautiful than you were before. And it just, that art, that message gave me so much strength that I'm trying to pass it on to my patients who read the book, to you who is watching this YouTube video. And I'm so impressed with American Horror Story and what they did with this scene. And I cannot wait to watch the rest of the episodes and to share and reflect with you here. Make sure you like this video if you learned something, comment with questions that you have. Let me know other films or TV shows that are really depicting fertility. And let me know if you want some input from a fertility doctor about what they get right and what they get wrong. But this episode did a pretty good job. So be sure and subscribe to this channel so you get my weekly video. And as always, wishing you love, luck, and pineapples.